Hi, I'm Stephen Bruce. I run the Academy of Physical Medicine, and here's 45 minutes of free CPD for you. This is just an example of what we do. We run a free session every month, along with 70 plus hours of live learning with others CPD every year. If you'd like to see more, click the link in the info section below the video, and that'll take you through to our website. Enjoy. Hey, good afternoon. Welcome to the Academy of Physical Medicine. We have got a great show for you, an extra show in our calendar this lunchtime. It still counts as 45 minutes of learning with others CPD. A few things before we start. I'm going to be talking to Stephen Barabash about laser therapy. Now, he is a representative of the K Laser company, but this is not specifically about their product. I suspect we'll learn just how good that product is, but this reflects laser therapy generally. And there's a lot of technology behind it and quite a bit of science behind it. And I've actually got an 81 slide deck hidden away somewhere in the gallery, which we aren't going to be showing you. We're going to show you a few slides from that from that deck. But what I will do is I'll give you a handout afterwards. So we'll be bringing the slides up on the screen next to me. Stephen will be talking about all sorts of technical stuff to do with lasers. And afterwards, we'll let you have all of those as a PDF handout. So don't get too worried if you can't follow everything that's on the slides right at this stage. Why are we doing this? Well, we're doing it for a number of reasons. First of all, laser therapy has come on in leaps and bounds over the last few years. And in fact, I can't remember whether it was a year ago or somewhere about then, but we had Stephen and one of his colleagues on the show to talk about laser therapy. And even since then, laser therapy has changed. And he hasn't told me how yet, but he's going to in a little while. We were looking at buying lasers for my own clinic. We're still looking at buying them for the clinic. And so, what we're very keen to do is explain why they're useful as an adjunct to our physical therapy, how you might use them in your own practice if you wanted to get your own laser equipment, or even how you might access laser therapy through other sources if you don't actually want to invest in that kit in your own practice for the time being. So that's kind of set the scene for what we're going to be doing today. Let me introduce Stephen. Stephen, you've got all sorts of fancy titles on the website and things like that. You're a fellow of laser therapy or something, aren't you?
Oh, there is a British Medical Laser Association, so yeah, I'm involved with them, right. Which represents the whole of the medical laser industry in this country.
And your background is what, your own personal?
I'm actually a veterinarian.
Yep.
So I graduated in Glasgow. All the rest of the family are doctors. But yeah, I went on the veterinary route. And I was looking for technologies which would help me in treating osteoarthritis. I mean, I used to be the tech director of a big pharmaceutical, MSD, in the USA. But even though I still use non-steroidals, that's only part of what I'd like to offer. And so on the human side and on the veterinary side, we do a much more of a multimodal way of treating pain management and osteoarthritis. So
you are still in clinic then?
I still, for my sins, do 1 and 2 weekends, right. Which keeps me real.
Yeah, which is really important, isn't it? Because
incredibly important.
Very often we have, when we're talking about things maybe similar to laser, we have people who come in who are either on the technical side or they're on the clinical side, but you've got a lot of both. So
I think it's important because where I'm sitting here today was not something pre-planned. Kind of like the rest of life, it sort of flowed into itself.
Oh, I thought you were talking about this broadcast. No, we planned this broadcast.
But
we only told you last week you were coming into the studio.
That's true.
That was a bit of
but in regards of just my general philosophy on how I'd like patients treated, it doesn't matter whether that's a human or an animal. We're lucky to be in the UK. We're lucky to have that desire to go and improve human health and animal health. Yeah. And therefore, whether it's pain medicine or it's rehab post-sports injuries, they overlap.
Yeah. Well, I'm impressed that you're wearing scrubs for the interview, because we have got a model lined up for you to demonstrate the equipment, and I suspect she's getting quite nervous. I mean, why is he wearing scrubs? What's going to happen in here?
Yeah, there's no operations today.
Right. Well, okay, look, let's get on to the lasers. Lasers been around for a very long time. And lots of people have got lasers or have looked at buying lasers, and there's a whole spectrum of prices and whatever. So first of all, let's start with the technology. What and how does laser actually do?
Well, first of all, thank you for inviting me, because
you're very welcome.
Unlike pharmaceuticals, it's a very poorly regulated market. Any medical equipment has a lack of scrutiny in regards of it. All you have to prove is safety. So I think it is difficult for your audience today. I hope they enjoy the lecture, but it's important that they do their own scrutiny of what they're spending their hard-earned cash on, and also making sure that what they're buying is actually going to really benefit their patients and not just ticking a box. And that's an important aspect about it.
But yeah, and one of the things that I wanted to get out of this discussion really is obviously a look at what the equipment itself looks like, because people possibly don't know just how bulky or mobile or portable it is, but also to give them the criteria by which they might decide to buy K-laser, or they might decide to buy some other class 3A, 3B, class 4 lasers, because all these terms are bounced around, and it's very hard for us mere osteopaths and chiropractors and so on to keep track of what it actually means.
Sure.
Actually, I'm probably speaking very personally from there when I say it's hard to keep track of. I'm sure that you have a perfect idea of what all these things mean.
I mean, we could use some slides as an illustration.
Yeah, okay.
It might help the audience a bit. So if we went to slide 2 first off, this might give them an idea about how it operates. So, the word laser stands for something. It stands for light amplification of stimulation, emission of radiation. Radiation in this current climate with Putin doesn't sound very good, but actually there's a lot of safe radiation out there as well, and this is what we're using in laser therapy. The critical world is photobiostimulation, and it's a use of these wavelengths of light to actually biochemically change things within the cellular and physiological structures.
This is how therapeutic laser has always worked, though, isn't it, regardless?
Yeah, regardless of that. Since then, there's been lots of different words bandied around. So you talk about low-level laser therapy and high-intensity laser therapy. But the truth of the matter, what you want is a laser that is able to go and change things biologically for the better in the body system, and do it in a time frame that fits in with an osteopath, chiro, physios, timescale, massage therapist. And that's a critical thing. Within our own laser, we have both low-level and high-intensity lasers. And that's because you don't need a high intensity for the skin, but in order to do things in a time efficient basis, you need a high intensity laser in order to penetrate deep into the tissues and do it biologically.
Can I just pick you up on that? Not pick you up, but just go back a little bit. You said earlier on that medical equipment isn't well regulated other than for safety. And you've just mentioned that osteos and chiros and physios and massage therapists can use laser technology. When they come to get insurance for it, are there any hurdles that people have to jump through to prove their competence with the therapy?
I mean, we work very closely with the insurance companies. Not all insurance companies will cover it, but the majority do. As long as they have got all the training certificates and they've got the proof that the actual company has not just dumped a laser with them, but gone through the whole process. And there is a thing called the core of knowledge, which they need to sit. And if they've proven that and they've got the certification on their specific machines that they've bought, then the insurance companies should be able to go and cover them.
Right. Okay. Sorry, I interrupted you.
No, it's an important aspect. So if we go to slide 18 second, then that will explain a little bit about what's the critical aspect in regards to lasers themselves. Well, so slide 18 here, what that's trying to show you is the actual what you're showing at is the molecules. Okay, so here in this one here, these are the critical molecules. So whatever laser you're looking at, they need to have wavelengths that are peak absorptions of these areas. So we all think about green plants and chlorophyll, and plants look green because of the absorption of sunlight. Well, these molecules all have a color, whether they're in the infrared in regards of water, which water has a color in the infrared, or copper in cytochrome C in our mitochondria, or iron in hemoglobin, and obviously we know the colour of melanin in our skin and our hair. But each of those has the absorptive capacity, and they're all titled this thing called chromophores, and they're light-absorbing molecules. And when they absorb that photon of energy from light, then they can create and replicate what the body should be doing, whether it's an osteoarthritic joint, or it's a healing skin, or whether it's a tendon injury. And you put in motion aspects of what the body should be doing and make it more efficient. And that's what the energy of photons is doing, absorbed by these different molecules in the body.
And can you target which ones you wanted to
you
be
can,
affected by?
But if you look at what we're trying to do here, in targeting water, the most common area where water is actually in the circulation. So you can open up capillary beds, and that's really important for perfusion to heal, but it's also important to get away the waste products. And if you're in an osteoarthritic joint, it will reduce the inflammatory cytokines by just improving perfusion. But in doing that, it's then going to bring blood there. And you know, if you've got osteoarthritis or you've got post-surgery injury, you may not be very active, but we can trick the hemoglobin to dump oxygen there. So now you've got the nutrients, you've got the oxygen there, and now when we target cytochrome C, we can raise the cell metabolism, whether that's a neurocyte in your spine, or whether that's a tenocyte in your Achilles tendon, or whether that's an osteoblast. And in doing that, then we can improve the functionality.
And does that mean you would have to decide which of these you were targeting?
No, we do it all in our laser, which covers all 4 wavelengths areas. We would do that simultaneously at the same time, all of them working in unison.
Okay, good. I think I understand that now. New words for my vocabulary, chromophore.
Indeed, no problem. And if you look also at the previous slide, which is slide 15, that kind of ties in the whole aspect about it here. So what we're talking, sadly in this strange world we live, radiation is a word that's coming up now, but we are what's called non-ionizing radiation. Okay, yes. So we're in this visible, which is where the red light is for treating melanin in the skin, but also in the invisible, which is in the infrared sector. Yep. And these, there are specific molecules you saw on the previous slide that we can then target and go and improve the cell's, cell metabolism as well as the physiology of the patient. What we're not is ionizing radiation, which is on the far left, which is the X-rays, the gamma rays, and the UV. So we're not damaging tissues. We're not causing any issues in regards of the body itself. We're stimulating healthy healing processes.
So what is it with the men in black glasses that we have to wear when we're using this then?
Well, I think they're more on the ionizing side of things, so we're not going there today.
No, but we have to wear glasses when you use the technique.
You do, yeah, sorry, true. You do need to, because we do not have a visualized change in our iris because we do not perceive infrared, unlike some of the animals in our planet, and therefore we block out the infrared. We can still visualize the red, which is around 660, and therefore we can see where we're aiming the laser. Yep. But we're not. We're blocking out the potentially damaging infrared, which our eyes won't be able to detect. Therefore, we don't get an iris constriction.
Right. Okay. I understand.
Okay. There are other aspects about lasers. So wavelengths is the most important aspect about it. And if we looked at slide 12 is going to look at power, and you kind of talked about this earlier. So you are right, lasers have been around a long time. You know, I could have shown a slide of Einstein and his theories of lasers and the potential benefits and negative side of certain lasers.
You must be the first person ever to pass up a chance to put a picture of Einstein, usually looking very disheveled and saying something. We only had so many slides I could show. So in regards to this is an American National Standards Institute, so that's why it's called ANSI. Yeah. And it's what the whole world has adopted in regards of measuring powers of lasers. Okay, and if I was in a lecture here, I'd be using my laser pointer, and obviously that's not damaging. You can, it's a very, very low power. It's only up to 0.4 microwatts, which is a tiny amount. Which is laser printers and CD
and laser printers. You don't need goggles when you're doing your computer or anything else like that, or even looking at this TV screen. But when we get up to class 3B, that was the earliest sort of biological lasers, which were sort of developed in the 60s, going up into the 1990s. And that was deemed as safe in regards of what you could do from a therapeutic point of view for patients. The downside was the amount of time it took to be able to do that. So you can do some excellent work in regards of acupuncture using lasers. And a class 3B, even a class 2 sometimes could be utilized for that, if that's what you're only interested in. Yeah. But if you're trying to go and do deep musculoskeletal tissues, and you're trying to do joints, and you're trying to do backs especially, then the advent from about 1998 in Europe and 2002 in America allowed class 4 lasers to be deemed as safe for therapy. And that's the only legislation out there, really.
When you say safe with the bunny ears, it makes me think you don't believe it's safe.
No, I do believe it's safe. Right. But that, you know, a class 3B laser can also be dangerous if you shine it in someone's eyes. So safe is, you know, all of these used badly could cause some problems, especially in eyes. And therefore, you know, whether it's a class 3B or a class 4, you still need goggles. We ourselves as a company have deemed that we only sell into the medical trained professions and the manual trained professions, because we want to make sure that they're using it legitimately and they're using it properly, and they understand both the disease and the way of using the laser to get the best results out of it.
These pictures at the bottom, of course, are showing that there is a broad range of what class 4 lasers actually include.
Absolutely.
Shooting down aircraft, etching steel or whatever that thing's doing there, and then
surgery,
cheering up
and then here's the Greek football star going and treating his inner groin for problems. So
isn't your poster boy Rafa Nadal for
we
this?
do, and I was very happy about the Australian Open. Yeah, you know, to see someone come back at 36 and defy the odds and win that, and he has very bad patella tendinopathies.
Yeah.
So not surprisingly, he's like built like an ox, and you know, good 30 years running around tennis courts does damage to you. But the fact that we can keep him ticking on with a good physio team means that actually he can still play at that level, and you know, obviously limit the amount of playing time he does, but he's back playing at that level.
That's a good sort of lead in to talk about what you can actually address with laser therapy.
Yeah.
So okay, so we've got a tendinopathy there.
So as the second slide I was showing you, in treating the hemoglobin, the mitochondria, and the circulation, where you target that, you can improve the overall aspects of tenocytes, myocytes, osteocytes. So I think that's the hardest things to people to judge, because we're so used to popping a pill and it knocks out our receptors for a pain. But actually we're doing a lot more than this. It's a bit more like an anabolic steroid, but legally we're able to go and boost all of the tissues.
Right.
And when you target over a certain area, you still need the compliance that you'd use with a drug or with a manual therapy technique. But when you have the compliance and the right laser, then you can really improve the overall tissue functionality, physiology, and the overall clinical results.
And I'm going to make a broad leap here, legal not least because there are no significant adverse side effects, which there are with anabolic steroids.
Understood. Yeah.
So are there any adverse side effects?
The side effects would be eyes, which you've alluded to already. And because you don't have a blink reflex for infrared, you do need to wear glasses, as does the patient. And there are different distances away. So most people working within a clinic, the people working in that room would need to wear goggles. It will be different distances to different lasers.
Right.
But in regards of other aspects, we have got some data which we work with the Dental Association, where we've shown that you can safely use it post-squamous cell carcinoma removal, which is quite a big leap of faith to where you're thinking about a biostimulator. But we've done studies on 101 children with squamous cell carcinoma and not caused recrudescence of the cancer. Right. I still would be a little worried about doing it directly over cancer, but some of your clinicians who are watching today, you know, if they are, you know, if there is inadvertently an osteosarcoma or fibrosarcoma, we're not going to cause that to go and get even more virulent or melanotic or malignant, sorry.
Yeah. I want to address some of these questions that are coming in. The first one is, this has come from a chap called James, who hasn't given us his surname, but he's online and he's sending his best wishes from Skiathos in Greece. I think maybe he was taken by the picture of the footballer you showed him a minute ago. Lawrence says, I had an older 70s patient of late who commented that she'd received laser on her neck for OA. And she mentioned that her neck was sore for a while before she gained benefit. Is that normal? And how does it work on such deep structures?
Yeah, I mean... we
could demonstrate that.
We'll demonstrate it later. We've got Susie who's going to help us today. I think... Can I show you, to answer that question, dosage, which is slide number 20. Right. Because I think that will illustrate why it's important. Because different wavelengths will penetrate different depths. The best penetrating beams are around the 800, around that area. And if your clinicians who are watching today were only treating skin, then they probably wouldn't be watching this thing. But most of them are dealing with deep pain and chronic pain and some acute soft tissue injuries. And what this is showing is the dosage you need. And in order to go and get dosage, you need a lot of energy. And that's in the energy of photons. So you're taking light energy to chemical energy within the body system. And you can see that actually is quite a high level. So someone like that neck pain you're talking about, you either need a lot of time or you need more power of the machine. It's those two compromises. Hopefully you've got the right beams to start with, and those are the two differentials in regards of that.
When I think about dealing with chronic soft tissue injuries, very often I'm thinking, well, I'm going to have to re-injure this in order to stimulate a healing process. Is laser doing any of that? Or
your analogy there is more analogous to shockwave. Shockwave does.
But also to manual therapy as well.
Indeed, manual therapy where you're provoking a reaction to try and stimulate healing. I put a good therapeutic laser as doing a good cookery course. You're putting all the ingredients in there and sort of stirring it up and hoping that you end up with a really nice cake at the end of it. You know, you're creating an environment there that optimizes healing. So sometimes, you know, if you've got a chronic Achilles tendinopathy, using shockwave or really deep massage therapy to go and break up that scarring, and then using laser is a really good combination, because they're, you know, a good therapist, you know, requires quite a lot of, you know, for a deep musculoskeletal requires quite a lot of force. Similarly to shockwave in that respect. And this will help in regards of it, of trying to put it back together so you're not just re-scarring where you've just broken down some scarring.
Debs has sent in an observation. She's been using K-laser for the past 7 months. Amazing results with her chronic pain caseload, which is nice to hear. And I'm sure, you know, I have to say this, I'm sure that other lasers are available, but what we want to get out of this is how would we decide which is the appropriate one for clinic?
I think we can go to slide number 21, which is just the one after this, I believe. And this is a critical thing. So we've shown the importance of wavelengths. So the wavelengths, hopefully, whatever laser you buy, they're able to penetrate deep enough and they're able to go and target those key molecules in order to create that optimal environment. So really it's down to you as a clinician thereafter. You either need a laser that has enough power that you can fit it in short bite-sized areas, and we're talking no more than 5 minutes for a neck treatment or a back treatment on a good laser, but you need enough. If you don't have that, you need a lot more time, because in order so that this isn't just some sort of bogus treatment that you're shining at someone, in order to get that clinical effect, you need that combination to work in unison. So this is a given, and then hopefully you've got enough energy there that you can fit this in with all the good things that a clinician's using already at this point in time. So
you talked about high intensity laser a little while ago. Does that have the potential to cause damage if it's such high intensity?
If you stayed over a tissue for a long period of time with a high intensity laser, you could potentially raise the temperature to cause damage to the tissues. You know, for instance, our laser, you know, in treating someone over a dark skin, it recalibrates, so it uses less 800. In order to make sure that you're not getting too much absorption of the skin level. So there is certain clever aspects that you can try and mitigate to make it as safe as possible. But again, it's down to training, and it's down to the education of the clinician using it properly as well.
Okay. Don't I remember you saying something about pulsing of this as well? Yeah,
there is. That's, I'd call that the oil of the good laser. So if you looked at slide 24, what slide 24 shows you is we've talked about wavelengths, we've talked about power, and the effect on how long the laser's used for. This is we're not talking the wavelengths, which is the sort of pulse. This is like you and I annoyingly turning on and off a light switch. Okay, so it's the packets of photons that you're doing at any one point in time. And what this slide shows you is you've got 4 different cell lines. So you've got smooth muscle, you've got leukocytes, you've got endothelial, which is a new blood vessel growth, and you've got bone cells. So quite different types of cells there. Yes, this is Petri dishes. And looking at our laser, if you fired our laser with the continuous wavelengths at all these different lines, you can see actually you stimulate a lot of white blood cell growth, which is important if you've got a wound, But it's also important, maybe you've just had surgery on your cruciate and you want to get some white blood cell action to actually clean up some of the mess inside there, okay? It's a kind of healing process. It's also good for blood flow, okay? At lower frequencies here, you can see you got much better bone at sort of up to 2,000 times a second, that's turning on and off a second, you get new blood vessel growth. And anything over 2,000 up to 20,000, you get smooth muscle, myocytes, skin cells, okay? So in treating a joint, actually what you want to do is a whole variety of different pulsing, so you can treat all the cell lines at their optimum level, okay? And that helps in regards of it. So it's if I was only doing a wound, I'd probably only start on continuous and do high frequency. Or if I was doing an Achilles tendinopathy mid-tendon injury, I'd probably only start with continuous and a high frequency. But if I'm doing a joint, which is most of what we're doing, there is soft tissue, there's smooth muscle, there's new blood vessel growth, there's the whole range.
And in this bottom slide here, which is the bottom part of the slide, which is probably only just visible on the camera, it talks about a variable duty cycle. What is the duty cycle on that?
So what you can see on here, you can see on everything bar the continuous, it's on what we call a 50% duty cycle. So it's on off 50% of the time. So if this was 8 watts, that's going to average 4 watts. Or if that was 20 watts, it will average 10. If we go to slide 25, it's slightly different, okay? So what you can do with a super intense pulse is you can give a little packet of photons at an incredibly high power and peak much higher. And instead of it being 50% duty cycle, it may be on for 30%, off for 70%. So the duty cycle is what you're alluding to, changes. And that means instead of us just getting hot skin, we can bypass a lot of the scatter in the skin, which is our biggest enemy in regards of using lasers, and get as deep as possible to that tissue without causing superficial heating. Okay. But beware, because I said this is a poorly regulated market. So some lasers say, oh, we can do 100 watts power, and you're like, whoa, that sounds really, and you're talking about skin burning, that would make me a little worried, okay? The reality is they're only on for a billionth of a second. So if you have, say, a 50 watt power laser, and you're only on for a thousandth of a second, actually you're only giving 0.0 joules, 0.05 joules, which is nothing. It's like a class 2.
What does it need to be?
It would be a class 2 laser. That would be a class 2 laser.
So where would that be for a class 4 laser to get therapeutic effect? How many joules?
You are up to 10 to 185 joules per
that makes a big difference,
per centimeter squared. So that's a factor of several thousand. So with that, you could do maybe an acupuncture point, but you're not going to go and treat a hip joint or a neck joint as your client was asking.
So the big question there is, when you're looking at buying a laser, is to find out what the power delivered is, rather than
how long the duty cycle is. Just high power.
The average power.
High power, the average power. High power doesn't mean much until you know whether it's delivering it per second enough.
I'm going to quickly ask you some more questions, then we're going across to shine a light on Susie. Lawrence has asked, same Lawrence as before, has asked, would this facilitate fracture healing?
Yes, there is some really good. We work both on, as I said, the human and the veterinary, and it is used post-surgically. Sadly, in the NHS, not as much as I'd like it to, but an example is Guy's and Thomas's, where initially we were using our laser for all the worst-case hand injuries, where they'd had surgery, they'd had therapy, they'd had everything, nothing was working, no drugs were working, and we were using it on the worst-case chronic peripheral neuropathies and things like that, and really bad scarring of tenopathies and things like that. But now we're using it proactively, and the aim is to go and reduce those end-stage problems that are inevitably happening when you're operating on complex things like hands. So yes, if you use it proactively, not only on the bones but on the tendons, you can have very good success in healing and accelerating that.
Someone's asked a question, I haven't got their name, but it's a question which I know came to our minds when we were first looking at laser. Do we have to make any changes in our treatment rooms to use this kit? No shiny floors, no shiny walls?
Again, part of the installation process is to do what's called a risk assessment. Now, a risk assessment is just to make sure your room is laser safe. I've never had a local authority check up on one of my clinics, but I never want them to come back and go, you didn't tell us this, So we actually do it to a very high level, and there are local rules that we have to follow, and we make sure everything's done properly. and therefore when we leave that clinic, if ever a local authority decided to pop their heads in the door, they would have been done it to the standard that it's necessary.
Look, Stephen, I've got quite a few more questions in here, but we need to go and demonstrate this kit.
No
so
problem.
if we go across and do some stuff with
Sure.
Susie, I'll ask questions while
Sure.
we're doing that as well.
Sure,
So
sure.
let's go across there.
Okay.
Right, Susie, thank you for coming in and volunteering
worries.
yourself as a patient again.
Thank you, Susie.
What are we going to do?
So I believe today we're going to treat, if we have time, a little bit of Susie's neck, and then also go and do Susie's elbow as well. And so you'll show two different aspects about this. First of all, you can see the portability of the laser.
That's it.
That is it.
There's no big box
we
behind
decided
it.
to put it on a silver tray to make it look a bit bigger than it is today, but yeah, that is it.
You can't have a silver tray because of bouncing laser lights and things like that.
For the purpose of this will be all right because we're not shining it over that.
Thank you.
Okay.
My men in black moment.
We're going to give you these, which are sort of wraparounds, and it's important that the goggles you're using are specific to the laser because it should have a CE mark on the side. And that will tell you exactly whether it's specific for the laser that you're using. Okay, everyone will be slightly different. Okay.
Tell you what, I can't read my questions with these goggles. I can just.
I'll tell you when we're going to do it. Okay. So the beauty about this is it's calibrated, but if you go to the plus version, then you can actually work out and change things accordingly. But for the majority of us, we're quite happy just understanding what's wrong with the patient when we're going to treat them, and the machine will go and have that pre-calibrated. Okay, so if we go into this, you can see it's on programs. I'm going to start with this one, which is the sort of more standard treatments that we would do. And in the case of Susie, we'll go and do the cervical. You can see it's based on 3 different sizes of individuals. Really, that's a child, mesomorph, endomorph in regards to body size. And then we're going to go and do a cervical spondylosis. Okay, skin type's really important because I said both the red and the infrared, especially the 800, can be absorbed by melanin. And Susie's quite light-skinned, so we can go on a skin type Fitzpatrick 2. And then in regards to the chronicity, it's sort of a little grumbling pain. We're not going to go to the extreme in regards of it, but we'll do chronic and relatively high levels of pain. And that's pre-calibrated there. So you can see we're giving about 2,600 joules. It's averaging 8 and peaking at 20. And we're going to do it over a 5-minute session. We're not going to do the whole session for today, but you can see it's also using all of the wavelengths. And if I go into here, it asks how we're going to deliver that. And that's an important thing. It will recalibrate depending on what head we're going to use. At this point, we're just going to use the standard head. And what you'll notice here, this is a fiber optic, okay? So I unwind the fiber optic, because the actual laser is being produced internally to the machine itself, okay? The machine sounds like it's on, but actually it's not on until I actually release the trigger there, okay? So in regards of Susie, the machine setting at the moment is set at 150 square centimeters, okay? So when I go and turn this on, I have it as perpendicular to her neck surface, and I will just literally lightly touch her skin. If I was doing a back, I might put a little bit more pressure on there because actually you can almost use the head as a deep massage, which can be quite a nice sensation. But at the moment, I'm just going to gently go over, and you can see there's just a standard hand movement there as I'm just going back and forth over the whole of the cervical area.
What can you feel, Susie?
Nothing actually, apart from the wand kind of moving on my neck.
Yeah.
That's good. I mean, it's if I stop there slower, then you can feel a little warmth.
Yes, almost tingly.
Indeed. There's a slight tingling sensation, but it's not an unpleasant sensation.
No.
Is the beeping just telling us that the laser is active?
When I showed you those differences in the pulsing, what that was doing is it's automatically, because obviously a neck's fairly complex in regards of all the different cell lines in there. And at each of those phases, it's trying to optimize a different cell line. So it will start at continuous, go from low frequency, and then go through those other aspects. And so it will change as it goes through that.
Yeah.
Okay. And I don't need to concentrate too much on the machine itself. I can just concentrate that I'm actually targeting the areas. And obviously, in a normal scenario where Susie and I would be talking, going back and forth in regards to how she's feeling, or it feels a little bit more there, I'll spend a little bit longer over one area, and it will allow me to go and adapt to what she's telling me as well as what I would like to go and do over the bigger area.
The big difference between this and ultrasound is, for example, I mean, the wands look very different, very similar.
Yeah.
With ultrasound, you've got to stay right over the tissue you're trying to work on, whereas you're waving that around quite a lot.
You do. I'm working over a sort of wider area. One of the important things we did from our own research was we showed the importance of blood circulation.
Yeah.
And I think we forget, especially in the spinal area, how important blood circulation is in order for the health of those neurocytes and all the other surrounding faucet joints and everything. So if I can go on a slightly wider area, I will increase blood flow to all of the soft tissue and the bony structures in that area. So that's important, yeah. And we did some research on that, looking at that. I can stop it at that point in time if I wanted to reassess. You know, Susie may want to go and flex and move, and then and the machine doesn't change. It will just start exactly where I left off, and I can just restart, and it will just continue going on. So, you know, it's very rarely that someone feels uncomfortable. The few times I've had that is people who've got really nasty fibromyalgia, and in which case I might slightly down-regulate the first treatments just to allow them, with their sort of aberrant sensation, to be able to tolerate it. Right. Because sometimes in those rare scenarios it is a little bit more intense.
You might have to go over something again, because there's a couple of people who have sent in questions about safety here. Mandy and someone called Horse Collector, I'll go into why they get these funny names, saying that they thought class 4 lasers were more for surgical purposes, and that as manual therapists we're better off using 3B or low intensity.
That was the case in the 1980s and 1990s, but you know, class 4 lasers now are well established in the therapeutic, both in Europe and in North America, and now in Asia as well.
So is there any role for 3B lasers anymore?
I think if you have a lot of time on your hands, or you're really only treating acupuncture, then class 3Bs have a good part to play. And you know, if you're able to hold it over one area for a long period of time, then that's fine as well. Most of us, though, you know, when you're treating a patient, yes, they've got a point emanating from maybe their spine, or they may be coming in with an Achilles tendinopathy, but you'll more often find that it's actually related to some other part of the body in an imbalance, and therefore you are often treating more than one location during that time frame.
We had a couple of people, Terence and Daisy, asking about fractures again. Terence was talking about stress fractures, Daisy about shoulder fractures. You already said that it's good for treating fractures, to helping the healing process.
Yeah.
How specific do you have to be with that? Do you have to be right over the fracture site? Or
you'd be doing it right over the fracture site, but interestingly, whether they've got cerclage wire or lag screws or metal, you can actually treat with it. So unlike a shockwave where you would be contraindicated, you can use it on there. If there is a big plate, you just do it from the contra side, because you will get reflection back off that plate, and you don't want to go and do it on the tibia or on their femur, where there might be, you know, you just get reflection straight back to the skin. So you do it from around the sides of the actual thing. But if you have cerclage wire or lag screws, not a problem at all. If it was like in a biceps or Achilles.
Chandra's asked about whether you can use it on peripheral neuropathy, you know, for example, in diabetics, and is it effective?
Yeah, we have a number of studies where we've gone and shown the benefits in regards of diabetic ulcers as well as neuropathies. There is a study that we did on 70 women with a peripheral neuropathy of their lower legs. Unfortunately, it was induced by cancer treatments that caused the neurological damage, but in doing that, it was a crossover double-blind study, and it had a very good success rate.
Okay.
If I stop this now, just do it for the first side. Is that okay, Susie? Was that feeling good?
Fine.
Yeah. So I'm going to stop this and push this back. You can see we've almost finished the whole treatment there, and it was going through the phases. I'm just going to show you one other aspect about this machine. So this is Stephen Bruce went and alluded to the fact that there's some new technology here. So on this head here, not only does it deliver the energy, but it also detects it coming back. And that's important because we never want to over-treat an area, and the feedback photons allows some modulation in the amount of photons we're delivering at any one point in time. There is something also on this machine that goes and takes it to a new level. So I showed you that side on the left-hand side. On the right-hand side here, what you've got, it looks for all sense and purposes the same. We start at the same. And if we were doing, say, the cervical again, and we can go down and treat the spondylosis, and we treat the type 2 skin, and we do the same level there. Now it asks you how big an area. Before it was calibrated at 150 square centimeters. Now we're doing a bigger area now, and we can choose a bigger area or a smaller area depending on the symptoms that Susie was showing. So if I slightly change that, we could click on the 4 there, and we can increase that maybe by another 10 centimeters. And in going and clicking on there, you got this sort of darts board effect there, which again looks different. Not all of us are laser physicists like myself in this. I've had to learn a lot in the last decade. Most of us understand that terminology of anti-inflammatory, about deep perfusion, about analgesia. And you can change all of this as and when you feel as a clinician, which is important. So you're much more in control of terminology that we understand in the medical or manual therapy area. But again, it allows you that capabilities. And so when I do this, it shows you the same heads, and you can do it remotely or directly as we're doing now, and it will go through this process, and that will give you a different sensation. This machine actually goes up to 30 watts. So some of your people were asking about, the power levels. Yeah. Well, in this case, we are now able to go up to 30 watts, which is delivering a lot of energy. But what I've learned in the last decade of using laser therapy is actually the limits of what we thought was capable of keep being pushed further and further. Sometimes you need to use less energy, which is calibrated into the machine, but other times, especially on chronic pain and deep musculoskeletal spinal injuries, more energy can be more beneficial.
Well, we've had a couple of questions about what else it can do. Simon has asked whether it can be used to treat cardiomyopathy, but also I believe I saw something about it being used for respiratory problems as well.
Yeah, cardiomyopathy, I don't think we are at that point in time. I don't know of any study globally where they're looking at, could you, after damage, it can definitely penetrate down to the heart. But I don't know of any study there that's actively looking at improvements in the heart, both neurologically and muscularly. In regards of your other thing, absolutely. For a long time, you could see, interestingly, that it was a shorter treatment time now when we did that, because we were using quite a lot more power. That was okay, yeah?
Yeah, it felt warmer.
Stephen, we've got 4 minutes left.
No problem.
So, we're at sort of approaching the end already. As always with these short shows, we try to pack a lot in. Can I ask you some quick fire questions?
Go for it.
Yes, no type answer?
You asked about, the lungs.
Yes.
And yes, during COVID, we were doing research both in Asia and in North America, and it came off the back of work that we were actually doing in the dog, because in the dog, Westies get chronic pulmonary interstitial fibrosis as a genetic problem. Yeah. So we'd already got working with University of Minnesota. We'd done a lot of work with them. And therefore we already had the technology and some of the protocols. So we put that into place, and actually in Malaysia and in other European countries, they were using this technology for COVID patients and as an acute respiratory pulmonary fibrosis problem.
Right. Okay, so with good success.
They've got published papers out of that.
Fantastic, yeah. I'm not sure, are you aware of any manual therapists using it for that purpose in their clinics, or is this all sort of consultants?
There are, yeah. The person I refer to most actually is a chiropractor in North America, and Dr. Hall. He's probably treated 500 patients, or managed 500 patients with chronic pulmonary fibrosis, and they come from all over the country to go and have his treatments. Compliance, we haven't spoken about, is important. So like a drug, you need to be compliant, and therefore we talk about people coming at least twice a week. You can come more frequently if you've got an acute injury, but twice a week for at least 3 weeks to go and see some biological effects taking effect during that time frame. Okay. And then you might go on a maintenance dose.
So other conditions, how about can it be used in conjunction with shockwave? I see one from Deb.
Absolutely. We actually sell a shockwave, so I actually think shockwave is a very good tool, but it is a little bit more of a blunt tool than a good laser therapy. But
sorry to interrupt, I'm trying to rush, of course. We had somebody who's very, very familiar with lasers, and I don't know whether it's your laser or another, but we were talking about getting shockwave in my clinic, and her advice to us was, well, if you're going to get laser, don't bother with shockwave, because this will do pretty much what shockwave will.
It depends on which level you're at. If I was doing out-and-out sports medicine and I was seeing a lot of chronic tendinopathies, then a shockwave and a laser, a good laser, is a great combination therapy, because, as I said, shockwave does a better job of breaking up the scar tissue, but if you're a great manual therapist, you may be able to do that manually without having to use shockwave. Laser's better at putting it all together and not rescarring, because one of the things the study shows is you create a lot more type 1 collagen with laser and less scarring type 3. So you don't rescar where you've just broken up scarring, which is important.
Okay. You got one word answers on these. Can it be treated? Can it treat OA in the hands?
Yes, we work with Guy's and Thomas's.
You've got one word answers, I'm afraid, because we're right out of time. So what about degenerative disc disease?
Yes, sort of.
And can we take our glasses off now?
We can.
I've been told. Look, I've got some more questions on my list here, and I'm really sorry that I've had to rush through this last bit. But as always, we get really soaked up in the discussion, and we've just run out of time for everything. I will send out the slide deck for you, so you'll have perhaps not all of the 81 slides, but I'll give you a PDF handout of all the things that Stephen would have liked to have discussed. If you want any more information, then contact me, and I'll make sure you have Stephen's direct contact details as well, as long as he's prepared to share them, of course. But that's all we've got time for this lunchtime, which is astonishing. It's gone so quickly.